Welcome, and as you know, there's quite a few conditions that are long-term conditions that are endemic in many societies. And these are things like obesity, heart disease, chronic lung disease, diabetes, high blood pressure. And these are well known to be risk factors for more severe COVID disease, the comorbidities. But perhaps one of the most common comorbidities is obesity. Just so many of us are overweight. So obesity contributes towards so many disease processes, as well as COVID-19. So I want to have a look at the background of obesity and how it's affecting COVID-19 specifically in this video. So let's just dive into that straight away. So COVID-19 and obesity. First of all, we need to do a little bit about obesity to get a bit of a background. So people who are overweight or obese, obesity just means very overweight, really. Now, in terms of COVID-19, these people are at greater risk of severe symptoms. The data is in on that. They're at greater risk of ending up in hospital compared to someone who is not obese. And this is concerning because this applies regardless of age. Even if they are young, this is still a factor. Now, just yesterday we were talking about the increased number of cases in young people in the United States. And as we'll see, overweight and obesity is actually quite prevalent even in young people in the United States. So that's what got me thinking about this. This could well be a significant factor in generating more severe disease in younger people in terms of COVID-19. So UK and obesity first, then we'll go on to the US and obesity after that. So UK and obesity. 28.7% of adults in the UK are classified as obese. This is not rare. A further 35% are overweight. That means getting on for 2/3 of us are overweight or obese. That means 36% of us have a healthy weight. Don't take my word for it, check up the references. Now, this is just an incredible indictment, really. Just over 1/3 of us are at a healthy weight. The rest of us, 63.7%, are obese or overweight. Most of us are overweight. We carry too much fatty tissue, too much adipose tissue. And this potentially putting the majority at increased risk. So this number, of course, is the majority. So this single risk factor is increasing the risk of severe COVID disease and potentially even death, and certainly hospitalisation in the majority of people, simply because we are carrying too much adipose tissue. Now, that's the situation in the UK. Now, let's look at the situation in the US. And my data here comes mostly from the Centre for Disease Control, and they have specialised dietetic parts to them as well. So this is government data from the US. Now, in the US, the prevalence of obesity is 42.4%. And that's according to 2017-2018 data, which is the last full data set the Centre for Disease Control currently publish. Don't know why they're quite so out of date, but that's all we've got. Is it any worse or better now? Well, obesity trends have been basically increasing in the United States since 1962. It's been an increasing upwards graph since 1962. Now, to be fair, there's more awareness, so I would guess that this figure is about what it is today. I would guess. It's not too far out anyway. Overweight is a further 32.5%. That means about 1/4 of people in the United States are of a normal, healthy weight. So 1/4 of people in the United States are at a healthy weight. This is adults over the age of 20. This data applies to. Now, BMI of more than 30. BMI is body mass index. If more than 30, it's obesity. If it's 25 to 29.9, that is overweight. So to have a normal weight, you need a BMI of less than 20. Now, BMI takes into account body weight, age, sex. You see, if you're older, you're likely to have less muscle. If you're male, you're likely to have more muscle. Female, less muscle. So these things all play into the equation. But basically, it's comparing your weight with your height. And if you click on there, you'll go to the body mass indicator calculator. There's quite a few of these. This is the NHS one. It's very good. You can have feet in inches, you can have kilograms, you can have whatever you want. And I actually clicked on mine and did mine this morning, and I was at 27.4. So I'm in the overweight category. Overweight category. Need to lose a bit of weight. As many of you watching that this are thinking exactly the same thing, of course, and we'll certainly can give some guidelines on that. Anyway, obesity-related conditions include heart disease, stroke, type 2 diabetes, certain types of cancer. Now, this only came out about 10 years ago, that people that are overweight are much more prone to certain forms of cancer. Now, I'm more than happy to do a full video on that if the demand is there, because it's an interesting area. Relatively new research, but very thorough information on that has come from the UK Cancer Research Council. So we have good epidemiology on that now, no question about that. Leading cause of preventable premature death. So what we see is, for example, we know that people with diabetes are much more prone to get severe COVID disease and much more prone to die from COVID disease. But we see that obesity is a big risk factor for diabetes, the so-called metabolic syndrome form of diabetes. So obesity looks like a direct risk, and it also looks like an indirect risk for more severe COVID disease via the intermediates of causing diabetes, of causing heart disease, of being a cause in high blood pressure. All of these things are more common in people that are overweight. Still thinking about the United States here. Annual medical costs of people that are obese are about $1,500 a year, more than people that are not obese. And medically, of course, over the country, this adds up to a couple $100 billion or something. You know, huge, as well as the social, medical, psychological cost of obesity. We have this crude but necessary to think about financial cost of obesity as well. Now, ethnicity, again, this is related to the United States, where the data is pretty good. Non-Hispanic blacks, so African Americans, basically a half of African Americans are overweight or obese, actually obese. Hispanics, it's pretty high. This is because remember, in the United States, we're talking about, of the total population, 42.4% being obese. This is a body mass index of over 30. So this is not overweight. This is obese, actually obese. So African Americans, it's 49.6% are actually obese, with a body mass index of over 30. Many more, of course, are overweight. So pretty well half are obese. Hispanics, it's about 45%. Non-Hispanics whites, it's 42%. And non-Hispanic Asians, it's relatively low. Now, just to clarify here, as we need to do, and we've done it many times, Asians in the United States typically means people from East Asia, like Chinese, Japanese, Koreans. Asians in the UK typically means people from the subcontinent, Pakistanis, Bangladeshis, Indians. So that's what that means in the United States context, typically. Because in those ethnic groups, there are specific issues related to diabetes, for example, in the UK that are well known. Now, age, again, United States data. Younger adults, I was somewhat surprised about this. Younger adults in the 20 to 39-year-old age group in the United States, 40% are obese. Quite staggering numbers. Middle-aged adults, it's 48%, age 40 to 59, and for older adults, it's 42%. And remember, this is obesity we're talking about here, not overweight. So a lot of young adults in the United States have got a very significantly increased risk. Now, in terms of the COVID pandemic, what does this mean? Well, it means that the figures we've looked at from China, for example, where we see that there's fewer young people getting severe disease and fewer young people dying, those figures are going to be somewhat skewed in the United States. And the proportion of young people getting sick and the proportion of young people getting critical and the proportion of young people dying in the United States is going to be somewhat higher. Now, the risks for young people are still way lower than older people, but because there's so much obesity in the United States, unfortunately, we can expect to see more casualty figures for severe disease, hospitalisation and deaths in the younger age group in the United States than in other countries due to the high prevalence of obesity in the United States in this young adult age group. Now, we're talking about obesity. It's very important that we don't stigmatise. This, to me, is a simple medical problem. It's vital to do no further stigmatisation. Those who are overweight or obese, as they may already suffer from poor healthcare and self-esteem. Now, there's actually studies done in the UK that people who are obese enjoy a lower quality of healthcare than people that are not obese enjoy. So, in other words, it appears there is, and I've worked in healthcare for 40 years, I've not been aware of this prejudice, but the data shows that it's there. We discriminate somewhat against people that are overweight. Unacceptable. You see, being overweight to me is a medical problem, pure and simple. In fact, to me, drug addiction or alcohol is a pure medical problem. And even just in the last year working on A&E, to be fair, I've come across prejudice against alcoholism. And to me, it's just another disease. It's not like people decide to become obese. It's not like people decide to become alcoholic. It's a complication of life. It's a medical condition to me, like any other. So very important not to stigmatise. And if you want to see the research that demonstrates that this has taken place, even within the health services, click on that link and it will give it to you. Now, specifically in terms of COVID, a study from China, for example, people who developed critical COVID and died had a higher average BMI than people developing only mild disease. So they took all the people that developed mild disease, looked at their average body weight, it was lower. They took all the people that got critical COVID disease or died, and their average weight was, the average body mass index was higher. Simple epidemiological finding. Study from the US. Younger age group patients hospitalised more likely to be obese. So again, and we're seeing this now in the United States. This is playing out in front of our eyes, unfortunately. The younger age group who are admitted to hospital are more likely to be obese. People from the UK admitted to coronary care, critical care units, intensive care units, 73% were overweight or obese. Now, I know that you're saying, well, that applies to a lot of us anyway. So from the data from the UK, remember it was 63.7 obese or overweight. So we see that people that are obese and overweight are disproportionately represented by about 10% in data from the UK. Now, moving on to the COVID symptom tracker app data. This is taken data from 2.6 million people, taken daily. Their height, weight, medical condition and daily health reports are all known. So huge study, 2.6 million people. People who are obese are about 20% more likely to be hospitalised with COVID symptoms. So that seems to be kind of the bottom line, really. That's the highlight for this video. Obesity is increasing risk of hospitalisation by 20% compared to people with a lower body mass index. And of course, 20% is a huge amount. It's a fifth. It's a big amount. More likely to need respiratory support such as ventilation. Again, this is data. This is based on 2.6 million people reporting. Across the age groups, and again, the UK data and the European data and some American data, this is across all age groups. This risk is increased as well for the young that are obese. So youth is not protecting young people that are obese as much as we would like it to, compared to young people that are not obese. It's including younger people. And again, click on the reference, look it up. Now, obesity also, and this is according to the same COVID symptom tracker data, obesity, as well as affecting health, we know it affects health, of course, we've been through that, but it also directly affects immunity. And there is data to back this up, good data. Increases the chance of developing chronic health problems, diabetes, heart disease. Okay, we know that. Hypertension, some cancers, that's known. But it also directly, so the obesity contributes to these things, and these things reduce immunity. That's one thing. But as well as that, the obesity is reducing immunity apparently directly. And here's the evidence for that. So increased risk of infections. And again, click on this, look it up for yourself. Impaired immune response. Again, click on that, look it up for yourself. So there's an impaired immune response in obesity. Your immune response if you're not obese is likely to be better than your immune response if you are obese. Easier for bacteria and viruses to invade the body and set up infection. Again, check on the data. This is what the data is showing. Makes severe COVID complications from infections more likely, e.g. acute respiratory distress syndrome, the ARDS, where the alveoli fill up with fluid. More likely in obesity. As well as that, background information, people that are obese are more likely to catch seasonal flu. They're more likely to be sick for longer with seasonal flu. So more likely to catch seasonal flu, more likely to be sick for longer, more risk of severe outcomes with seasonal flu, and indeed more likely to transmit the infection to others. And again, this is not speculation, this is all based on the data from seasonal flu. Check it out for yourself. So quite significant risk there. Now, why is there so much obesity? Combined interaction between physical, social and environmental factors. Now, we could talk about this for hours, and if you want me to, of course, I'll make a more detailed video on this. But obesity is complicated, that there are strategies for dealing with it. It would take me a while to explain them, but there are strategies that I've seen work effectively many times. And we can talk about those if there's a demand for that in more detail, but that's somewhat without the remit of this video. But be assured there are effective management strategies for obesity that can lead to significant and sustained weight loss. Now, tips for obesity in the current pandemic. Obviously, the usual things, the big three: social distancing, hand and respiratory hygiene, face coverings. They're the big three. Move towards a normal weight. So we're not saying go on a crash diet. This is saying move towards a normal weight. Now, think about good nutrients. So it's not just the food. See, malnutrition. Malnutrition just means mal is a medical prefix. It just means abnormal. That's all mal means. So malnutrition is abnormal nutrition. So if I don't eat enough of a nutrient, I'm malnourished. If I don't eat enough carbohydrate, I can be marasmic. If I don't eat enough protein, I can get kwashiorkor. If I don't eat enough vitamin B, I can get beriberi. If I don't eat enough vitamin A, I can get night blindness. If I don't eat enough vitamin C, I can get scurvy. All these nutritional deficiencies are well known, but also bear in mind that there's a lot of subclinical nutritional deficiencies where nutrients will not be at optimum levels, but might not be giving immediate signs and symptoms of deficiency. There's that to consider. But of course, malnutrition also includes overnutrition. So personally, I'm malnourished in terms of carbohydrates. I eat too many carbohydrates. That's a form of malnutrition. It's too much of a nutrient. So it's thinking about nutrients, getting the right nutrients, eating food with the right amount of nutrients. So excuse me, vegetables, for example, and things. We're thinking about flavonoids, we're thinking about the vitamins, we're thinking about the minerals, and the different sorts of fats. Again, I'm happy to do this in more detail. I've done videos on this already, but I'm happy to do more detail. But think about malnutrition as eating too much and not eating enough. Now consider vitamin D as well. Now vitamin D, 10% in most people comes from the diet, 90% comes from the sun. We know that now. Now the thing is about vitamin D, you can take supplements, of course, to boost your vitamin D. And how much you will need to increase your blood levels of vitamin D depends greatly. So for example, if someone is very obese, say a body mass index of 30 or more, and they are very deficient in vitamin D, when that person starts taking vitamin D, suppose they start taking a couple of thousand units of vitamin D a day, then that's not going to increase their blood levels for quite a long time, because what happens is the vitamin D is a water-soluble vitamin, A, D, E, K. The ADEC vitamins are water-soluble. So the vitamin D will go from the gut into the adipose tissue, and it wouldn't be topping up the blood, and it's only when it's in the blood it's doing the good that it needs to do. So such a person might need to take that amount of vitamin D for months before they topped up their vitamin D level. So obesity, the fatty tissue, if you like, sort of takes preference for the vitamin D, and it only gives what's left over for the blood. So people that are obese are more likely to be vitamin D deficient, and we've given huge amounts of evidence on this channel that vitamin D deficiency is associated with reduced immunological performance. Also, for people that are obese in the current outbreak, pandemic, regular outdoor physical activity is good. Movement is good. Uses energy, fresh air. As long as you're socially distanced, that's a good thing. Consider mental health, and also people that are obese because of the greater risk should talk about a flu jab with their doctors. And it looks like the flu jab policy is going absolutely full steam ahead in the UK. So I'm aware that was a bit rushed. Basically, we've got a pandemic of obesity. So not only have we got most people, the majority of people in the UK and the US are obese, but this is actually spreading all around the world now. So obesity is an increasing problem in Africa and India. Not because necessarily they're eating too much, but because they're eating the wrong sorts of foods. Not enough of the right sorts of foods, too much of the wrong sorts of food. This is the nature of the problem. And the evidence now is clear that people that are obese are at greater risk of immunodeficiency and at greater risk of severe and outcomes in COVID-19 disease, and at greater risk of death. So we need a huge public health movement to reduce global immunity. That's going to involve you as an individual, it's going to involve your family, it's going to involve the society you live in, it's going to involve legislators, it's going to involve food manufacturers. But that's where we need to get to. But in the meantime, we need to be aware of the increased risk, and we need to take enhanced precautions to protect against the immediate COVID-19 threat in people that are obese.